Good morning, everyone. This is Dr. Van Merkle at Take Two Healthcare. It's great to be with you this beautiful, very sunshiny day. Wow. Longest day of the year. Hopefully, you all get out and enjoy it. I'm certainly going to, but boy, this is sunshine. Perfect. A little warm. Make sure you stay hydrated. Drink plenty of water. I'm Dr. Van Merkle, Doctor of Chiropractic, board certified in clinical nutrition. Been right here in the Miami Valley for wow, several years. Behind this marvelous WHIO microphone for over 25 years. It is truly an honor, a blessing to be with you on this marvelous radio program, WHIO, and News Talk Radio. And I'd like to welcome everybody who's listening online. Yes, anywhere around the world that there's internet, you can listen to this marvelous radio station and keep everything up to date and know what's happening in the Miami Valley. And I'd like to thank everybody, and I'd like to thank all the patients out there who have been with us over the years, and we've had the honor, truly the honor, blessing of being able to help you with many problems, some very serious, some things like cancer, autoimmune diseases, lupus, MS, severe digestion problems, Crohn's, ulcerative colitis, things like that. And our philosophy here at our Take Two Healthcare Center is that even serious problems sometimes have simple, safe solutions. Even serious problems sometimes have simple, safe solutions. And, we spend thousands, hundreds of thousands of dollars when maybe all we need to do is make a little modification. And we've seen that with some people with cancers and other things like that. Not that we have a treatment or cure for cancer. I don't have a cure for lupus, MS, or anything, but if a body gets healthy enough, does it really matter the name of the disease? And here's something when I'm lecturing across the country, I always ask doctors to always consider this question when you're talking with a patient. And I always say the most important question you need to ask your patients is, how long have they had the problem? How long have you had the problem? If somebody 50 comes in and says, well, doc, I've got this skin rash, I've got this ulcerative colitis I've had for 3 years. I'm thinking, well, why do you have it now? If you lived the first 47 years of your life without these problems, why do you have it now? And so my job isn't to just throw some vitamins at you or to change your diet and hopefully you get well. Our goal is to test you and see if we can actually find the reason or cause that is driving your symptoms. Oh, and I can tell you some real fun ones here, and I've talked about these over the years. Typical fella, 65, 63-year-old male comes in with high blood pressure, high cholesterol, he's got ED, an upset stomach, and he's tired. And he's on a statin drug, a blood pressure drug, statin drug for cholesterol, a blood pressure drug, and takes drugs for indigestion and for ED. He doesn't want to be in my office. His wife made him come. His medical doctor said, oh, you're just getting old. Don't worry about it. And he said, all my buddies have the same problems that I do. So he didn't want to be there, but his nagging wife made him come. How terrible is that? Well, we did the testing. And we do a thorough laboratory evaluation, and we also check for toxicities. And one of the most common toxicities we test for is heavy metal toxicity. And here's a highlight, or here are just a quick review of his symptoms. First of all, he was very low in vitamin D. I think the clinical range for vitamin D is like 40 units. He was down to 7. Extremely low vitamin D. And I always ask the doctors who are at the lecture for continuing education units, I say, okay, doctors, could a low vitamin D cause high blood pressure, high cholesterol, ED, and fatigue? And they all respond, yes, it could. Yeah, low vitamin D could have caused all of his symptoms. And I say, can you guys fix low vitamin D? And they all say, yes, we can. And you for about $40 a year, you can buy 5,000 international units of vitamin D for a day. Every day for a year, you can take 5,000 units. Now, if you're out in the sun today, you're going to get some sunshine, which would be good for you. Sunshine is not only great to help produce vitamin D, but as I know this is COVID time now, the virus and I've talked about studies over the last few weeks that show that ultraviolet light from sunshine kills COVID virus virtually faster than anything. Kills it within just seconds. It kills the virus. So you need to go outside and breathe in and out, get your lungs cleaned out, get all that crap in your lungs out. And I'd recommend when you're outside, do not wear a mask when you're outside, especially if you're walking by yourself and there's plenty of space between everybody. Get that bad air out of your body, get that bad junk out of your lungs, and breathe deeply. And I know everybody's worried about skin cancer. I think we're going to review the COVID deaths here coming up. I think cancer is much less of a problem right now than COVID. And we're going to talk about that here. I'm going to actually disagree with what I just said here when we're going to go into the actual statistics on COVID. But so he had low vitamin D. He also had high cholesterol as such, but he had also high ferritin. He had a mild condition, called hemochromatosis. It's not the severe form, but his iron levels were too high. And could iron levels that are too high cause fatigue, ED, high blood pressure? Yeah, it can. So even though he didn't have extreme hemochromatosis, it was a benefit for him to donate a pint of blood. And donating a pint of blood could very well be a factor in him improving. Two simple things: vitamin D and donate a pint of blood. We did a hair test, and we saw that he had extreme high levels of copper. Copper. Yeah, very high levels. Now, there's a disease called Wilson's disease, and I'm not talking he had at that level, but copper that's too high is bad and hard on the body. And when you look at the side effects of extreme high copper, you're going to find that high copper can cause fatigue, digestion problems, high blood pressure, and a host of other things. So where is he getting the high copper? Where is he getting the high copper? Yeah, probably from his copper water pipe. So what does he need? He needs a little water filtration unit. He needs to drink filtered water. He's getting too much copper, and that's bad. He's also had high levels of lead and mercury, and high lead and mercury can also cause high blood pressure, high cholesterol, ED, and fatigue, and digestion problems. So what did he need? He's probably getting the lead, mercury, and copper from the water. He needs a water filter, vitamin D, and donate blood, and we've helped him 90% right there. Right there. Just those simple things. He was going to take blood pressure drugs and cholesterol drugs and have ED and things the rest of his life. And within days, he was able to get off all of his drugs. Something simple. Vitamin D, donate a pint of blood. Easy. And what happens if you got a health problem? And we've seen people with severe problems. I could talk about cancer cases whose immune systems were compromised. And once we relieved and boosted their immune system, I'm not saying their cancer was cured, but it went into remission. The numbers, the cancer markers, even MRIs and things all showed improvement. I'm not saying it's cured, but we have cancer every day. So if it goes into remission and it doesn't grow anymore, are you okay? Yeah, probably you're okay. Yep, you are probably okay. So that's what I want to get in your mind is that maybe that serious thing you're going. Maybe you've got an autoimmune disease, or you're just diagnosed with cancer, or you've got some other ulcerative colitis, you got psoriasis, you've got ED or whatever. Maybe testing yourself, getting tested properly, can show you simple, easy solutions to your chronic problems. How sad would it be if you're treated forever with very strong drugs that can cause cancer, drugs that can shut your liver and kidneys down, when you could have simply and safely got tested and provide a simple, safe solution. And generally, I'm not saying that it takes forever to find out. Our name of our clinic is Take Two Healthcare, and our slogan is Take 2 weeks or 2 months to try a safe, natural option. You know, most things will show improvement in 2 weeks. And that's why we have people who have cancer, and I'm not saying we're going to cure them or going to be well, but if we see their numbers improve in 2 weeks, if you've got ulcerative colitis, you've got an inflammatory condition, we see those improve in 2 weeks. You've got kidney or liver disease, and those values improve in 2 weeks. Not that you're cured, not that your symptoms are gone, but if you see improvement, that's encouraging to everybody that, hey, maybe you're on the right track. If it works, if you see a little improvement in 2 weeks, then try 2 months. But there are some conditions that we see that are so extreme that we can't wait 2 months. And we might run just an inflammatory marker. We might run a liver marker, or we might do a urinalysis just to make sure that what we're doing is working. We're just not going to guess. We're just not going to guess. We're going to develop some objective parameters, objective laboratory parameters, and then when we put you on a solution, we should be able to see progress. That's really the main thing. Now, when we come back, we're going to have just a couple minutes before the main break, and I will be taking some breaks. But I want to talk about COVID. And it has been, oh my, when I look at the statistics and the graphs, you know, there is very definite that COVID has had a significant impact on certain people. But there's been one class of people that the death rate has shown a significant decline. There's been a significant decline in this country for one group of people, and you're going to want to hear what that is when we come back from the break. You're listening to Dr. Merkle at Take Two Healthcare. We're here every Saturday, 11 to noon. We'll be right back after this. And we are back. This is Dr. Van Merkle at Take Two Healthcare every Saturday, 11 to noon, right here. And I'd like to welcome you listeners there. It's a great honor that you are listening this weekend, and hopefully you have nice plans to get outside and enjoy this beautiful weather. And if you'd like to contact us, our office is on Far Hills Avenue in Royal Swiss Village. And our phone number is 937-433-3241. That's 433-3241. And we've got a great website that you can find a lot of information at www.take2healthcare.com. Take2healthcare.com. There's a lot of great information there. And you will learn about our doctors we have on staff here. We got some great doctors. And we have Dr. Andrew Dyer, who is board certified in acupuncture and nutrition. Dr. Natalie Yaley is certified to read thermography, and she's been doing thermography with us for, oh my gosh, many years. And if you'd like a safe, painless breast scan, thermography is a nice option. And then we have Dr. Ashley Marchek, who is board certified in clinical nutrition and board certified in acupuncture. And we have some just phenomenal treatment opportunities here, and treatment protocols and things for different conditions. And during this month of June, you may have heard the advertisement. We do have a reduction in our fees of 50% in response to the COVID virus. We've reduced our fees 50% for acupuncture, for the adjusting, for consults. Vitamins and lab testing are not reduced. Our prices are so extremely low already, and we can't reduce those because we have to pay LabCorp. And so we already have great prices. In fact, you check our prices, and it reminds me of a lady who wanted to get checked for pregnancy. And she went to her medical doctor, and the test for pregnancy was going to run about $450. She called our office and found out that that same test was going to run $450 at her medical doctor's office that insurance wasn't going to cover, was not going to cover, was only about $30 in our clinic. $30 cash. So there's a huge difference in lab prices, and so that is why we are a cash-based practice, because we're not charging anywhere near the rate. And so if you don't have insurance, even if you do and you want to save your insurance company money, be a responsible citizen, I'd recommend you check prices here and even try a safe, natural option for your health problem. Now, again, I'm going to be running short here, but when we get back from the break, I'm going to talk about there's actually one group who's actually seen a significant decline in deaths compared to last year. A decline in deaths. Now, there's no doubt that there's been great increases in deaths, but as a result of COVID, there's been a decline in deaths. Okay, and I'm going to keep you hanging on that one, because that's going to take me a little bit of time. And I've been reading about it. It's fascinating. But I do want to talk about hospital payments and COVID-19. And some people are alarmed that I said, hospitals are being paid up to $13,000 for a COVID diagnosis and close to $40,000 if a ventilator is used. And and that looks bad. And here's a letter I get from Fact Check. It says it is true the government will pay more to hospitals for COVID cases by paying an additional 20% on top of traditional Medicare rates. So they get an extra 20%, and I suppose that works up close to 13,000, and other things too. And Robert Brenson Institute from the Urban Institute said revenues appear to be down for hospitals this quarter because many have suspended elective procedures, which are key to their revenues, forcing some hospitals to cut staff. Hospitals, everybody's been affected by this. And he surmised that potential instances of patients being wrongly upcoded or classified are trivial compared to other forces that are affecting hospital finances. Did you get that? If you miscode something and upcode it to a COVID-19 when it's not really, and you make the hospital an extra 13 grand, that's trivial, he says, compared to a decline in hospital revenue overall. Because a decline, well, that's still not right, is it? That'd be like going to a restaurant and something that's normally, I don't know, $12 if you go inside, but because it's COVID, we're going to upgrade you and give you a super extra high charge for putting it in a bag and carrying it out, or upcharging. That's something that the government takes a dim view of. If somebody's got extra mass during this time, and just actually happened, where they were charging like, I don't know, $25 for one simple mask that would normally be like $1 or $2. And everybody gets all upset when they do that. But if a hospital accidentally upcharges, well, everybody else is suffering, and obviously hospitals and things are going to feel some pain too. That doesn't justify upcharging and type of things like that. So less precise standards. And okay, Centers for Disease Control and Prevention and how deaths are classified as COVID-19 without corroborating positive test results could lead to an overcounting. If we think it's presumptive, if they think it is, they can go ahead and put down COVID-19. Or in some situations, even if it's negative, they can put down a COVID-19 diagnosis. Let's see. I thought there was something else here. But anyway, how would that be if that were in any other business? Your auto mechanic, Murphy's says, well, the test didn't show it, but we think you need a new motor, so we're just going to put it in. Even though we didn't test it, your motor was bad or anything, we're just going to put one in. In Colorado, it was estimated that 30% of all COVID deaths were not actually COVID at all, but due to upcoding. And so it's something you have to be aware of, that everybody's being affected by it. Now, we come back, we're going to be talking about a group of people who've actually seen a decline in deaths over this year and the previous years due to what's been happening with COVID-19. You're going to hear that because it's pretty amazing. This is Dr. Merkle. You're listening to Take Two Healthcare, your guide to better living. We'll be right back after these messages. And we are back. This is Dr. Van Merkle at Take Two Healthcare. Great to be with you every Saturday, 11 to noon. And I am Dr. Van Merkle, Doctor of Chiropractic, board certified in clinic nutrition, and I am just thrilled to be with you today. And our office is 937-433-3241, 433-3241, or take2healthcare.com. And we're in Royal Swiss Village. And we're talking about several things this morning. But this one study I came across, it kind of got me baffling a little bit. Lessons from the Lockdown is the title of the article. And it's published as a white paper from Health Choice. And We all know, and I'm not discounting it at all, that the deaths from COVID, and they've got such really nice graphs and charts on these deaths. I've never seen it so clear before. I know there's been other pandemics we've had over the years, even worse than this one, that we didn't shut the country down for. And but there's been others, and maybe this would have been worse if we hadn't shut it down. I'm not saying that, but when you look at the charts, it is clear that the U.S. death rates, and now I'm going to talk about weeks, like from week 10 through 21, there's a sharp increase from week 10 to week like 15 of the year, like 52 weeks in a year. So it looks like from week 11, it spiked up to the highest level by week 15, and then it has dropped dramatically back down to normal by week 21. And it's called U.S. deaths per week, figure 1. And that's pretty, and then they compare that to expected deaths by week. How many do you expect per week? And there was definitely an increase in deaths from the COVID, as we've been told. And so the number of deaths per week should be pretty much the same certain times of the year from 2017, 18, and 19. And in 2020, they should be pretty reasonable, but this year we saw a very sharp increase, which we all know. And then it's got deaths from all causes, and it talks about deaths from COVID, deaths from pneumonia, and deaths from flu. And those are all pretty significant, but there were pneumonia deaths, pneumonia and COVID deaths, and influenza deaths. So those are there, but there is a definite spike with the total deaths, and that appears to be due to the COVID, according to the graph. So that's all correlating well, and with what we see, and expected deaths. And I'm going through. It talks about New York City deaths per week, and again, a very sharp spike from week 11 to week 15. The spike in deaths in New York City went up extremely high, but they have dropped down by week 20. By week 20, down to almost normal levels. So it's not that we're seeing an extremely high spike and it keeps going up and up and up. No, it went up and now it's going back down, with the highest being, again, at about week 15. That was in New York City. And the high-risk jurisdictions, again, same thing. There's a very high spike until about April, and then there's been a sharp decline in deaths per week. Within just a few weeks, it's dropped back down to normal, and it's looking by May that the number of deaths from COVID have dropped pretty much down to whatever a normal level is, and then expected death rates. And then they talk about policy environment. To some extent, the policies have varied across states. It is not clear that the presence of stringent lockdown policies had much to do with the variation in excess deaths. Less stringent lockdown policies were not associated with higher death rates. Let me say it again. Less stringent lockdown policies were not associated with higher death rates. Now, why would that be? In fact, the 5 states that chose not to impose lockdown are among the roughly 20 jurisdictions with no excess deaths at all. None. And Minnesota had a far more aggressive lockdown policy, and I'm quoting its neighboring states of Iowa, South Dakota, North Dakota, and yes, Wisconsin, yet its COVID deaths were among the most concentrated in the country. Minnesota had very aggressive lockdown, and yet most concentrated in the country. But listen, this is the key part right here. Roughly 80% of Minnesota's COVID deaths occurred among the infirm, elderly who are residents of long-term care facilities. 80% of deaths were residents in long-term care facilities. Long-term care facilities, and I don't mean to be mean, mean-spirited or anything, but if they're in long-term care facilities, they're there and already very poor health, and they're probably potentially going to die with. They're there to die with dignity, and to have good care while they are in their last weeks, months, years of life. And so 80% is very important because that's probably across the board. As much as 80, 60, 70, 80% of all COVID deaths are among the very sick. Okay, age effect, elderly. One universally accepted fact of the COVID-19 pandemic is that the death rate is highest among the elderly. And the all-cause death numbers show this effect clearly. The stark increase in deaths among those 65 and older beginning in late March, peaking in early April, and then turning sharply downward in May, so that by month end of May, the excess death rate has almost disappeared. And so the excess death rate in just a few weeks has almost disappeared. But it's the elderly, the old have the problem. Now, and the age group from age 18 to 64 showed a similar pattern of excess deaths as the elderly, although the death toll was much less. Much less. But it spiked up and spiked down, but very much less. But again, we have to say that everybody that dies from COVID has comorbidities. It's like the flu. You don't die from the flu. You die with the flu. You die with COVID because you have already pre-existing, they call them comorbidities. And what are the comorbidities? Again, let's go over them. Obesity, high blood pressure, high cholesterol, not high cholesterol, high blood pressure, autoimmune disease, cancer, lung diseases. If you smoke, and I'd throw vaping in there too because it causes lung inflammation. So everybody who's dying with COVID has pre-existing conditions. Now keep that thought in mind. The impact is clear. The older the age the older the person, the more total deaths increased during the pandemic. The largest number of deaths, as well as increases in death, occurred in those aged 85 years and older, followed by those aged 75 to 84, followed by those 65 to 74. The sole remaining group showing an increase in death during the pandemic was a group aged 55 to 64. Okay, everybody, listen up. For all people ages less than 45, under 45, for all people under age 55, the impact of the pandemic is, and I quote, undetectable. If you're under age 55, the impact of the pandemic is undetectable. So if you're under 55, you don't have anything to worry about getting COVID. It's all about protecting the elderly, and everybody knows that. We all know that we're doing all this stuff. We are isolating to protect the elderly. Okay, now most observers believe they understand this age effect and discount it. That older people die more frequently is no excuse not to protect them from the pandemic. Older people die more frequently is no excuse not to protect everybody from the pandemic. Protect the elderly from the pandemic. But as we have deployed lockdowns, protect the elderly from a tragic and premature loss of life, we have missed a completely unintended and beneficial benefit of the lockdowns. Now, I'm going to talk about the unexplained benefit, unintended and beneficial benefit of the lockdown in a second. But I understand we're doing this to protect the older people. We need to do like Florida did. They locked down the nursing homes. They locked down the long-term care facilities so that those people couldn't get visitors. And my mom is 88. We have self-imposed a quarantine on mom so that she not go out around other people. Should we quarantine the whole country to protect a few of the people who are at high risk? Or should we impose quarantines on those people at high risk? That's what we did with my mom. We said, Mom, you're just not going out. She's 88. She's high risk. Just her age alone is high risk. But she's doing fine. And, family, friends do go visit her, but she's not in the general public. and she's doing fine. It doesn't make sense to quarantine everybody when we should do like Florida did. And if you're at high risk, quarantine yourself. Stay home. Have grocery stores deliver. You can have everything delivered. Go out and take your walks, but you quarantine yourself and do that. But as I said, and here's something I found very fascinating. There's been an unexplained collapse. There's been unintended and beneficial benefit of the lockdowns, and here it is. An unexplained collapse in excess deaths among the young, especially children and infants. Wow. And weekly deaths among adults dominate the U.S. overall, the overall U.S. death toll, and with most deaths at the older ages unless you get younger. Weekly deaths among children are scattered across the states and typically fall around 700, and half of those in infants under 1 year of age. But the pandemic experience, and I'll quote, has brought in a surprising effect on this unexpected death rate among children. Starting in early March, expected death began a sharp decline from an expected level of 700 deaths per week to well under 700 by mid-April and throughout May. Weird. That's a dramatic decrease in deaths per week. 200 fewer infants are dying. And here they say roughly 30% fewer children have died, 30% fewer children during this quarantine of people staying at home. So I ask the question, what's a protective effect? Was the school closures? Were teenagers getting themselves into less risky situations? No, there was little effect among school-aged children and adolescents regarding the decline in death rate. Virtually the entire change in death rate came from infants less than 1 year of age. The entire decrease in death rate in children was basically confined to infants less than 1 year old, to the count of over 200 per week were not dying due to the pandemic and people staying at home. Deaths in infants and children occur at a higher rate in minority groups. So the reduction in childhood deaths during lockdowns has meant that lives of Black, Hispanic infants and children have been saved at a higher rate. Now, every untimely death is tragic, but if one considered life years lost, a premature death of an infant carries more weight than a premature death of someone whose life expectancy is 5 years or less. Whereas the median age of death of, say, the Minnesota person dying of COVID in a nursing home, maybe they were 83 years of age, the typical life expectancy of that senior citizen might just be 2 or 3 more years. That was denied by the COVID-19. So by that 83-year-old person dying, they died 2 or 3 years earlier. But how about an infant? An infant, they talk about 80 years or more. We're going to cover this in a little bit more detail when we come after the break. You're listening to Dr. Merkle at Take Two Healthcare. We'll be right back. And we're back. This is Dr. Van Merkle at Take Two Healthcare. It's great to be with you this beautiful, longest day of the year. I always like this day, longest day of the year. Hey, but we're talking about a benefit of the pandemic where children, infants less than 1 year of age, are not dying at the rate they commonly do. Now, the most frequent reason for infants to die is congenital conditions, birth defects. There may be some accidents, homicides, or whatever. But one of the 2 most common causes of infant death is something called sudden infant death syndrome. Sudden infant death syndrome is one of the 2 largest causes of death in infants under 1 year of age. And that is what's seen a sharp decline. Over 200 fewer sudden infant deaths are being reported each week in the United States. So sudden infant death rates have gone dramatically down since the pandemic. Okay, why? So what has changed? Our infants' deaths not being recorded. Our parents taking better care of their families, better care of their children, and their children not going to school. There's many hypotheses about the infant death decline. But I've been reading in the medical blogs and journals for several months now, and there is a very high concern because here's one change that has received publicity is that the public health officials are very concerned about the sharp decline in infant vaccinations as parents are not taking their infants to pediatric offices for their regular well baby visits. They don't want to expose their children, so they're not taking them for well baby visits. What is the purpose of a well baby visit is to get your vaccinations. In the May 15th issue of CDC Morbidity and Mortality Weekly, a group of authors from the CDC and Kaiser Permanente reported a sharp decline in orders for vaccines as well as the decline in pediatric vaccine doses administered. Those declines began in early March around the time infant deaths began declining. So, as a good parent, you didn't want to expose your child, so you didn't even get them vaccinated. Now, could this have dire consequences? Could not getting all the children vaccinated have dire consequences? I mean, we're right now in a giant laboratory experiment that has never been done. And and I'm going to quote, COVID-19 is unique among recent pandemics in that the mortality toll is measurable, real, and convincing. What no one would have predicted in advance of COVID-19 is that the extreme lockdown response has produced a natural experiment that actually calls into questions the very actions, widespread mandated vaccines for all, that the infectious disease and public health community have been pushing for years. Now, we should mourn the deaths of the elderly Manhattan nursing home residents, but also take heed of the hundreds of avoided infant deaths. Hundreds of infant deaths. Now, there's another article, which I don't have time to go over. China is working on a vaccine, and the problem they're seeing is that the vaccine for COVID-19 may be only going to last 2 to 3 months. Okay, the COVID vaccine may not last very long at all. But here's the question. All right, children aren't dying from sudden infant death because they're not getting vaccinated. Here's the question. Will there be a rapid increase in vaccine-preventable diseases and deaths in infants in the next few months or next year or two because they were not vaccinated as medically mandated? That's the question. 200 children per year right now are not dying because maybe they're not getting vaccinated. Maybe it's because they're not getting vaccinated. So if these children aren't being vaccinated, are they going to have greater disease, disability, and death very quickly within the next few months, next year or two, as they start getting out in public and being exposed to other things? That's the question. Well, I hope this has been helpful to you, this show. Give you some things to think about. Really, that's why we're here, to give you options, give you ideas, but just really think about things and where you're at and what you want to do. And I personally would not do a COVID shot until it has been tested and proven for years. I wouldn't just jump on it. We have a flu shot, and 60,000 people die every year from the flu. Say it is a time to go, and I'd like to appreciate the opportunity of being here with you today. If you'd like to contact us, our number is 433-3241, 433-3241. Our website is take2healthcare.com. Say, do something today to be healthier than you were yesterday. Get out, take a walk, enjoy the sunshine, and take responsibility for your health. I'm Dr. Merkle.